who would otherwise be susceptible of ending up with a very severe case of COVID-19.
Also for Minister Duclos, what do you say to the statement from Chinese authorities that Omicron arrived in their country via a piece of Canadian postal mail?
Well, this is a conversation to be had with experts and scientists. As we know, and as the WHO has wanted to seek for quite some time, is more data and more transparent evidence from China on where and how the COVID-19 originated about 2 years ago now. So we expect that China to follow the guidance and respond to the requests of organizations like the WHO to provide, as I said, more transparency on not only what arrived, but also how we can work better together internationally with the WHO to make sure that whatever risk or outcomes arise in the future, we can better manage them at the global level.
Tom Perry with CBC.
Hi, Minister Duclos. It's actually a follow-up on that. What China is alleging is that an outbreak of Omicron in Beijing originated from a parcel or a letter that was sent from Canada. So given what we know about the virus, how likely do you think that is, that's the case? And if it's not the case, what do you think China is doing here?
Well, to be very honest with you, I don't know where that is coming from, and we'll check with officials and our partners around the world. I think this is something not only new, but intriguing, and certainly not in accordance with what we have done both internationally and domestically.
Given what we know about the transmissibility of Omicron, do you think there's any chance that a letter sent from Canada to China could have transmitted the disease?
Well, as I said, I'm no expert and would need to ask both for more information and more expertise on what is being claimed.
I would say that the experts can tell us what to think. I obviously have my own opinion, but for an opinion to be useful and credible, we need more information, and I think experts should speak to this. From Radio-Canada, do you think that this antiviral pill will eventually be used more widely than what is currently planned? Currently, it's for people who are more susceptible to severe illness. With current supply challenges, will we ever be able to broaden the scope of the use? Answer: experts would probably say that yes, because science is progressing pretty quickly. Today, we have enough luck to have a medication that would work for high-risk members of the population. These people need to be treated in the short term, obviously in the long term too. But from what I've heard, there will be improvements on this type of treatment, and there will be other kinds of treatment that will be available in the next weeks and months that will allow us to treat different segments of the population or treat different or more vulnerable people better. Follow-up question. When do you expect to see a significant impact on hospitalization rates throughout Canada? Also, we're competing with all other countries to get this drug. Are people playing dirty to get their hands on this medication? Answer: in terms of supply, Minister Tassi and her team and the entire government worked very well in the last few months. If we look at the international stage, we're among the first countries to have approved the medication, but also to have received the medication. There are certain countries who adopted different approaches in the last weeks, but to say today that we have treatment in Canada and to be able to distribute them quickly to the provinces and territories and to have informed clinicians how to use these medications is something to be proud about. Inaudible question. We have 30,000 doses for now. We're expecting 120,000 in the next few weeks. But as you've suggested, like with anything else, like rapid tests and vaccines, competition is high, but Canada is doing a good job. One reason for this is that when we have to get combined supply and approval processes, we have to say that there is a lot of faith in Health Canada's approvals. And so when we get that approval, it makes it easier to get approval in other countries. So Canada is a leader among other countries. So when we're seeking approval, we need to follow up with supply and procurement. And that's what we're doing here with today's announcement.
We will now go to the phone lines as there are no more questions in the room, and we will come back to the room if there is time. Over to you, operator.
Thank you. Merci. For questions on the telephone, please press *1 on your device's keypad. Pour toute question au téléphone, faites *1 sur votre appareil. The first question, première question, est de Raphaël Pirot.
Raphaël Pirot from QMI Agency. You have the floor. Question. Hello, Mr. Duclos. With regards to the treatment that has just been approved, can we say that this is a turning point in the pandemic? Will it help us reduce hospitalization rates? Maybe not for the Omicron wave, but maybe for future waves? Answer. Thank you for the question. The first thing I would tell you is that it's better to prevent than to treat. So it's better not to get infected to reduce hospitalization, but failing that, we can, and that's the only way to do that is through vaccination. So this is the best tool we can use both in the short term and the long term to protect us collectively and individually. The second thing is that there are some people who, because of their age or their immune system or their access to vaccines, perhaps they are immunocompromised or more vulnerable. For these people, vaccination protects them less. And so for these people, Paxlovid is the most useful extra layer. It's an extra tool, but it's not better than vaccination. Much to the contrary, for most people who are listening, vaccination is really the way to go to avoid infection rather than have to be treated and cured or healed. So despite today's news being positive, we have to continue to focus on vaccination, which is the key tool, and now we have an additional protective layer for more vulnerable people. Follow-up question. With regards to procurement and supply, how will this influence the distribution of the treatment? Currently, there are many guidelines to be followed before we can get our hands on this treatment. So one day, eventually, when we have millions and millions of treatment courses, can we expect these guidelines to be lightened? Answer, of course, this will help us treat COVID-19 in the long term, short term, of course, but mostly long term. This is a medication that will be used with other medications that are currently being developed. So more medication is good news. It allows us to better treat and heal people. But again, I would like to focus on the present moment. Currently, with Omicron and the current crisis, the best way to go is to get vaccinated and to respect public health guidelines. This is the main thing that will get us out of this pandemic.
Thank you. Merci. The next question is from Alex Bellengal from the Toronto Star. Please go ahead. Your line is open.
Yes, good afternoon. Thanks very much. Just on the arrival testing regime that we have at the airport. We have Pearson Airport, WestJet, and Air Canada today coming out saying they want this requirement dropped for, I believe it was asymptomatic arrivals, or remove mandatory arrival testing. So I guess for the mandatory testing for everybody. wondering what you make of that, Minister Duclos, and if you think that's a good idea, if that's something the government is considering doing, given the limited testing capacity that we have, obviously, in this wave.
Well, thank you, Alex, for the question, and three brief elements as a response. First, we are in the middle of the Omicron crisis. I was looking at the numbers just a few hours ago. Globally, the number of active cases in the world has doubled just in the last 2 weeks. And but the speed and the slope are very, very high. So there is a lot more Omicron infected people now in Canada as of January the 17th, as there were obviously a few weeks ago, but just a few weeks ago, certainly. And as I said, the trend is of great concern. There is obviously a lot of Omicron in Canada, and in Canada we have different levels of government. At the federal level, we have the responsibility to look after our borders, to secure our borders, and we take that very seriously. And we're using resources for testing, PCR testing at the border, which are different from the resources to which provinces and territories have access. So different responsibilities, different resources, and each of us at the federal or provincial level take our responsibilities seriously. The third thing I would say is that as the situation evolves, obviously we will keep adjusting our measures on all sorts of ways, in all sorts of ways, including at the borders.
Okay, so I guess different responsibilities, different resources. The arguments that I've heard is that obviously testing in general for PCR testing, the federal government could use the money and lab capacity that's going to these arrival tests to potentially help out provinces such as maybe Ontario and Quebec that are overburdened. I wonder what you think of that logic. I understand there's different jurisdictions, but maybe the capacity could be better used, I think some would argue. And then also, just to clarify the number of treatments quickly in the or the number of pills in each treatment of the new Pfizer treatment, if you could just clarify, is it 10, 20 in each treatment, I guess, package?
Thank you again. On capacity, I would also add that I'm in constant touch with my colleagues, health ministers across provinces and territories, and we are working together to make sure that not only do we have a good understanding of responsibilities, and they obviously have a role, at least a word to say on how we fare at the federal level in assuming our responsibilities, but also access to the appropriate resources that we need to deal with those responsibilities, and that will continue. On, I forget what your second question was now.
Oh, it's number of treatments. I'm not sure if I'm on the line anymore, but number of treatments, or number of
yes. Sorry. Yes, so 30,000 treatments that come with 10 doses per treatment, 5 days, 2 doses per day. I understand from the technical briefing that you had this morning that it's the maximum number of days is indeed 5 days, and the treatments need to start no later than 5 days after the first symptoms have appeared.
Is there another question on the phone line? Okay, Minister, if there are no more questions on the phone line, I'll actually also ask you a question just on the vaccine mandate for truck drivers. Could you clarify what the government is doing to monitor supply chains and whether it's leading to shortages and how the government will respond to that?
Thank you. I'll do that briefly. First, I think people are asking why we do that. Now, we do that because the best economic policy in the current context is a health policy that makes sure that everyone is protected from COVID-19, and the best protection is vaccination. We also know that this has been known for some time. Since November, all truckers and all trucking companies know that this is coming right now, and soon there will be perfect symmetry with the United States, because we both agree on both sides of the border that, again, protecting the health and safety of workers is also protecting the businesses that hire those workers and also protecting the supply chains. Now, as we have prepared for that, and as we keep monitoring the outcome of this important policy, my colleagues, Minister Algabra, Minister Tassi, obviously Minister Ng, others in the government, Minister Seamus, who is responsible, the labor minister, therefore with a direct and important relationship with federally regulated businesses, including the trucking industry. Now, we've been working very hard with them and successfully with them, because the vast majority of truckers have not made the right choice. They have had a vaccine. So we are procuring the level of support and supporting the level of engagement that the industry needs and deserves. And we'll do this for as long as COVID-19 is there.
Okay, thank you. It's my understanding we still have the phone line, so I'll ask again if there are questions on the phone.
Yes, thank you. Merci. Sorry for the inconvenience. De nouveau, pour poser une question, faites étoile 1 sur votre appareil. Once again, please press star 1 on the device's keypad if you have a question. La prochaine question est de Boris.
Next question is from Boris Proulx from Le Devoir. You have the floor. Monsieur Duclos, I would like to know how you feel about how people who are unvaccinated are criticized and how they will have access to this medication. Answer, yes, some of them are indeed vulnerable. They're vulnerable by the mere fact that they chose not to be vaccinated. I'd like to have a quick aside. We have to be careful when we talk about people who are unvaccinated. There are many types of people who are unvaccinated. Some would like to be vaccinated but can't find the time to go. Others would like to be vaccinated but would still like to wait more and have more information. Other people are getting their information from misleading sources, and other people are against vaccination as a whole. So when we talk about unvaccinated people, there are many people here. And among these people, there are many that are ready and might be ready very soon to actually get vaccinated. But the matter in which we treat unvaccinated people is that we have to treat them with kindness. In Canada, that's the way we do it. Regardless of where people are from, whatever their past is, whatever their choices, we accept them in our medical care centers. When they arrive at the hospital and they need help, they receive the help that they need. Follow-up question. Do you think that vaccine skeptics will then move on to use Paxlovid? Answer, I hope everyone will understand that an ounce of prevention is worth a pound in cure. If a person wants to avoid severe illness, first of all, because it's unpleasant, you have to remember that Paxlovid doesn't guarantee that a person will be saved. It just improves their chances of, it reduces their chances of developing severe illness. People need to understand that it's better to prevent than to cure. And that's why vaccination is always the basic, fundamental measure for protection of oneself and of others.
Thank you. Merci. The next question is from Ryan Tumulty. Please go ahead. Your line is open.
Yeah, Minister, I'm wondering right now the ability to get a PCR test or even a rapid test across Canada is pretty limited. I'm wondering if you are concerned that this new treatment will be difficult to actually, practically administer because it requires a positive test, especially since it has to happen within 5 days. Are you concerned that perhaps this drug will go unused because of that challenge?
That's a good question, and I believe experts answered a similar question this morning. And I'm not being an expert, I will provide a view which would not be as solid as the one you heard just this morning. First, on the people. Now, this is designed for people both that display characteristics that make them more susceptible to be vulnerable to COVID-19, and sometimes in circumstances in which it is more difficult for them to be treated. So people living in more remote communities with greater distancing from medical care provided in a hospital setting. So these types of people, immunocompromised individuals. So it's a population that is already suffering quite a lot from COVID-19. So that's good news for that vulnerable population. Now, this being said, there is obviously an important informational work that needs to be done, not only with clinicians, doctors, and nurses, for them to get to be fully aware of the uses and the possible benefits of this new drug, but also for possible patients, people that, as you alluded to, might feel symptoms of COVID-19, but that would not necessarily think of having a test, a rapid test or a molecular test. So sharing that information in provinces and territories with people that would already be vulnerable and sometimes more marginalized in terms of access to health information and health care. So sharing that information is going to be key in making that treatment as effective as possible.
Yeah, and just as a follow-up, you set Health Canada set priorities, or the Public Health Agency has set priorities for who should receive the drug. And relatively high on that list is people who are not vaccinated. I'm wondering if you're concerned that the pill could act as a disincentive to people who haven't been vaccinated, that they'll see the pill as something they can do instead of getting vaccinated.
I think not. I don't think so. I think this pill is going to be quickly understood to be used for people who would find it difficult to go through COVID-19 without the pill. But most of these people will have gained from being vaccinated. Now, you don't want to have to use that pill if you can instead be vaccinated. Vaccination is going to be a lot better at protecting you as a prevention measure. It's much better to be vaccinated and not to run the risk of having a severe case of COVID-19 than to have to be treated with Paxlovid because you're going to end up with a severe case of COVID-19. And I think most people will understand that, but it's obviously going to be important for every expert, doctors, public health officials in various provinces and territories to share that message so that, again, prevention is understood to be a lot better than just being treated or eventually cured for the disease.
Thank you. Merci. La prochaine question est de Mélanie Crête.
The next question is from Mélanie Crête from La Presse. You have the floor. Question. What's going on with the approval for Merck's antiviral medication, which was submitted for approval way before Pfizer? Answer. Thank you for the question. You would have to ask the Health Canada's regulatory experts. As you know, they are independent experts. These are two separate treatments. They are both very different from one another. So Merck's request, as you've probably understood, is moving more slowly because there are some specific issues for this medication that has been submitted for approval some time ago. Follow-up regarding Pfizer. On the 30,000 treatments that have been received, how many will be sent to Quebec? Answer, I believe it's approximately 6,000 courses that will be sent to Quebec. So it's divided per capita. So it's 30,000 divided by the number, by Quebec's population. So it's approximately 6,000 courses that will be sent shortly to Quebec. And with that, as I'm not a doctor, I shouldn't have specified how many doses this represents. Each treatment has 3 doses, 3 pills per day for 5 days.
Why a non-doctor would speak about these things, but I was asked a question earlier. So it's about the treatment. One treatment comes with 3 doses per day for 5 days. J'espère que c'est une réponse suffisante.
I hope that that's a sufficient answer.
La prochaine question est...
The next question is from Pierre Saint-Arnaud from the Canadian Press. You have the floor. Thank you. Hello, Mr. Duclos. My first question is this. It's about the cost. What is the cost per treatment, not per dose, that has two doses of 3 pills per day for 5 days? So it's 3 pills per dose, 2 doses a day for 5 days. So that's actually a lot of doses. But for complete treatment over 5 days, how much are we going to be spending? Answer, you know what, next time I'm going to ask you to come to the press conference to explain the dosage, but I will turn this over to Filomena Tassi, the Minister of Public Services and Procurement. She'll have a better answer.
You know, in order to protect the commercially sensitive pricing information, we can't disclose those details. What I would say is we have been very clear as a government that whatever it takes to help better protect the health and safety of Canadians, that's what we're going to do, which is why we have taken the step of procuring these doses and really are delighted that they are here now, ready to be delivered to provinces and territories. And I want to thank Pfizer for the strong relationship in working with us that we are in the position we are today, which is on the day of approval that we have the doses ready and look forward to those being used by Canadians to help protect them from the severe impacts of COVID-19.
As a follow-up question, Mr. Duclos, have you planned to have enough of Pfizer's antivirals to be able to give them to anyone without having a priority list? So anyone who develops symptoms that could or could not be susceptible to grave illness, who doesn't satisfy the criteria, are we hoping to have enough to distribute to the entire population? Answer, 2 things. From what I've understood, governmental regulatory experts have said that the submission from Pfizer was very particular. The trials were performed against a specific group of people. So our understanding of the medication's impact in reducing odds of grave illness is for these vulnerable populations. The second thing is that we could have broader coverage with this medication, but Pfizer would have to provide additional clinical information. Alternatively, there could be other drugs produced by Pfizer or other pharmaceutical companies that have clinical data to complement drugs like Paxlovid.
Thank you. Merci. La prochaine question est de Éric.
The next question is from Élie Plouffe from Radio-Canada. You have the floor. Hello, Mr. Minister. Can you tell us what your stance is about this request to have lighter restrictions at the borders and to eliminate the need to have a second PCR test for people who cross the border on land borders? Answer 3 things. 1, the epidemiological situation in Canada and elsewhere in the world is deteriorating. I noted that there were 31 million cases of COVID-19 in January, and now they're over, in early January, now there are over 50 million. So the increase in numbers of COVID cases is very strong here and elsewhere in the world. The other thing I would add is this. We have, at the government, responsibilities regarding managing the border. This is one of the sources of COVID-19 transmission. When people travel, they contact other people, they can catch COVID-19, and they can also transmit it to others through their travels. So, to be responsible, the Canadian government is employing resources that are different from the tools that provinces and territories have for testing. So we have our own suppliers and we send them elsewhere. And the last thing is that we will continue to adapt our measures to match the evolution of the situation. Follow-up question. So it's not a possibility for now. Answer, currently, no, that's not what's going to happen because of the situation. We don't think we've even reached the peak of infections. We're all hoping it's going to happen now, but we don't have any clear evidence to that matter. And when we look abroad, we see that the situation in other countries is worsening.
Thank you.
This will be the last question over the phone.
Very well. Thank you. Merci again. The next question and the last will be Palak Mangat from Parliament Today. Please go ahead. Your line is open.
Hi, thanks. This question is for Minister Tassi. It's on the costing front. I did hear my colleague ask about the possibility of this treatment being quite an expensive one to secure, but you didn't really provide a clear answer other than to say that we can secure another, I think it was about 500,000. Can you clarify if that's on the same contract or if you expect to take advantage of that given some of the practical challenges that we know about securing test results and the like, or will it essentially depend on the uptake of the existing supply flowing in?
Yes. So we're delighted to have secured this contract, which is, for the 1 million doses. We have an option for 500,000 more. I think the timing of this is also very important, which gets to your question, which is at a time where hospitals are, filled and they're having trouble accommodating all the patients, that this antiviral, that the bottom line is that the effect is that it keeps people potentially out of the hospitals is so very important. So we're going to monitor that, but this contract is for 1 million doses, but we have the option to exercise a purchase of 500,000 more.
Okay, thank you. And also to Minister Tassi, I know the government's sort of previous positioning on vaccine contracts, and I'm wondering if there has been any word yet to your office or the department around the Auditor General and when she could begin her audit into the contracts that we've got signed so far. And the reason I ask is that really seems to be the only source of transparency around vaccine-associated costs.
Yeah. So I would say this, listen, let me be clear. From the very beginning, we knew that we had to act and procure in order to protect Canadians, and that's what we've done. There are, of course, times where the information is commercially sensitive and we can't jeopardize the contract by disclosing that information, so we adhere to that. We are working tirelessly, of course, to get our hands on every possible measure that we know is critical to combat this this fight against COVID-19. And so the assurance that I can give you is that every step of the way, we are always acting in the best interests of Canadians, looking ahead, procuring what's necessary, and doing that in a very responsible way. And ensuring that the health and safety of Canadians is first and foremost, and respecting that there are times where we can't disclose the amounts, and that's and we're not going to put Canadians' health at risk by violating those provisions and putting the supply at risk.
Okay, we are going to turn quickly back to the room for one or two more questions, since there were so many more on the phone, starting with Tom Perry with CBC.
Hi, Minister Duclos, you were asked this in French. I was just hoping to get you in English. Why are unvaccinated Canadians among the group of people considered to be at a high priority to receive this treatment?
Thank you. We heard the answer this morning by experts. What was also said, and what I'm pleased to repeat, is that in Canada, we treat people as they are, and according to what healthcare needs they may have. So that's what doctors and nurses do every day. They don't ask questions about people's choices or people's human nature. They look after people. They care for people. This being said, a drug is a treatment. No, it's much better not to have to be treated, and the best way to not to have to be treated is to be vaccinated. So you don't want to end up with COVID-19, even though you might be given a drug. No, that's not what you want. You don't want to have COVID-19, and the best way not to have COVID-19 and not to run the risk of being severely ill is to be vaccinated.
And we will go to CP for the final last question.
For Minister Duclos, Jim Brodsky with CP. Just to follow up on the earlier thread about China and Tom's questions on that topic, you mentioned you have an opinion about whether a piece of Canadian mail could introduce Omicron to Beijing. What is your personal opinion on that assertion from the Chinese authorities?
Well, the opinion that matters most has to be based on information and on expertise. So that's why I will, and we will all want to defer to the views of experts on that, and I will ask my own experts within the Public Health Agency of Canada to look at that.
So you're not ruling out the possibility that a piece of Canadian mail introduced the Omicron variant to China?
Well, I find this to be an extraordinary view, but again, I am not an expert, a doctor or a virologist, and I will ask the right people to provide and to produce the right advice and the right views.
Inaudible. This is an extraordinary allegation, but I'm not an expert, so I would ask virologists at Public Health Canada to answer.
Conference, thank you to the ministers for being so generous with their time. That's the last press conference for today.